Pediatric hearing test is recommended annually between the ages of 4 to 6 years, and then at 8 and 10 years. Screening for hypertension is recommended for children with risk factors such as obesity, diabetes, prematurity, etc. STI screening for chlamydia and gonorrhea are recommended for females less than 25 years old and sexually active. For females 21 years and older, Pap smear is recommended for every 3 years. A Pap smear is a cytological test where cells are gently collected from the cervix and examined under a microscope to detect any abnormalities. This screening helps identify precancerous or cancerous changes early. At 30-year-old patient have the choice to continue Pap smear for every 3 years or add HPV co-testing and screen every 5 years. Pap smear screening is continued until the age of 65 years. HPV co-testing starting at 30 years old and is continued every 5 years. Patient can also choose to continue Pap smear screening every 3 years instead of HPV co-testing. Screen for hyperlipidemia in men older than 35 years and women older than 45 years if they're at increased risk for coronary artery disease. Risk factors for coronary artery disease are hypertension, diabetes, a positive family history for coronary artery disease and smoking. Asymptomatic men older than 35 years and asymptomatic women older than 40 to 45 years are generally screened in clinical practice. Diabetes screening in patients older than 35 years old, or screen in patients less than 35 years old with risk factors such as obesity. Also consider screening for diabetes for women who are planning pregnancy if they have risk factors for type 2 diabetes. Colon cancer screening starting at 45. Continue screening every 10 years with colonoscopy until age 75. If high risk, 10 years before the first-degree family member was diagnosed. If patient is diagnosed with ulcerative colitis, start screening 8 to 10 years after the age of diagnosis, and then colonoscopy every 1 to 3 years. If you find a low-risk polyp such as 1 or 2 small tubular adenomas, colonoscopy needs to be done every 5 to 10 years. If multiple polyps with atypical features or atypical serrated polyps are found, screen every 3 years. Breast cancer screening with mammography for females starting at the age of 40. Continue screening until the age of 74 years. Screening age was 50 years old previously, according to USPSTF guidelines. Hyperlipidemia screening for women older than 45 years if they have increased risk for coronary artery disease. Annual hypertension screening for individual older than 40 years. To diagnose hypertension, you need elevated blood pressure on at least 2 times on 2 separate visits. Lung cancer screening starting at the age of 50 if they have smoked more than 20 pack year or if they have smoked within the past 15 years. Screening is done using a low-dose CT. Continue screening yearly until 80 years old. Prostate cancer screening starting at the age of 50 for men. Screening is done using PSA test on labs. Osteoporosis screening for females starting at the age of 65. In high-risk patients such as anorexia, screening starts earlier. Abdominal aneurysm screening for men between the ages of 65 to 75 years old if they've ever smoked in their life. Screening is done 1 time using abdominal ultrasound. Special cases. In patients with cirrhosis, liver ultrasound is done every 6 months for hepatocellular cancer screening. Routine screenings with esophagoduodenoscopy is done to look for esophageal varices. In patients with chronic kidney disease, routine CBC is ordered to look for hemoglobin level because they could have decreased production of erythropoietin, which can lead to anemia. Labs will show decreased hemoglobin level, normal MCV, decreased reticulocytes, normal ferritin and normal transfer in saturation. If presented with esophageal atresia in a newborn, also screen for associated congenital malformations, VACTERL, and CHARGE syndrome. Pregnant females are screened on first prenatal visit for pregestational diabetes only if they are overweight, obese, with additional risk factors such as family history of diabetes, previous gestational diabetes, or a child with macrosomia, hypertension, or impaired glucose tolerance. Pause the video to answer these questions if needed. If patient has ulcerative colitis, when do you start screening for colon cancer? The answer is, start screening 8 to 10 years after the age of diagnosis, and then colonoscopy every 1 to 3 years after that. If a male patient has ever smoked in their life, what do you screen for at the age of 65? The answer is to screen for abdominal aneurysm with abdominal ultrasound one time between the ages of 65 and 75.